What's the difference between a suspension and a syrup? The first thing is written on the pack, right? Common sense. Some mothers will not even check what they're giving to their child. But this is not just what I'm going to talk about today alone. So the first thing is that for a syrup, the drug content is already pre-constituted in a solution. So you don't need to do anything. You just give your child whatever dose that has been prescribed. So you see, this is vitamin C syrup. What you need to do is already preformed. You give your child the medication and the dose that the child needs to take. Now for suspension, it usually comes in a solid form, in granules, a dry content. And so suspensions need to be diluted with water in order to get the appropriate drug content. And most of them have labels, signs like this, for instance. This mark is where the water has to be put to this point. So you need to read the label, and then they'll tell you where the water has to, the point at which you put the water. And for suspension, you always have to shake it. After diluting, you always have to shake it so that the drug content can be evenly distributed and the child can get the right form of prescription. Once a suspension is constituted, it cannot be left on the tabletop. It needs to be stored in the refrigerator and consumed within 7 to 10 days. So if it's in the dry form, yes, the expiry date would work. You can keep it on your shelf till when you need to use it. But once you've constituted it, you discard after 7 to 10 days. For the syrup, it can be used till the bottle is empty or till it expires. So for instance, if you have to give your child vitamin C syrup for about 5 days, you give and it's still remaining. Since it's a syrup, you can leave it where you keep your medications, and if you need to use it again, you pick it up, check the expiry date, and then use it again. Remember, keep drugs away from children's reach. Now you know you can do better. Cheers.